Hello and welcome back to my YouTube channel. Today I have a special treat for you. I was invited to speak at the In My Skin Real Conversations About Real Skin Summit hosted by Dermalogica. And I didn't want that talk to be left only for those that were able to attend that event. I wanted to share it with you here today. So without any further delay, here's the conversation that I had at the In My Skin Real Conversations About Real Skin Summit hosted by Dermalogica. Hello and welcome to the In My Skin Real Conversations About Real Skin Summit sponsored by Dermatologica. I am Dr. Dustin Portela. I'm a board-certified dermatologist and I practice in Boise, Idaho at Treasure Valley Dermatology and Skin Cancer Center. You can find me on nearly all social media channels at 208SkinDoc, and I've been a board-certified dermatologist since 2017. We're here today to talk about acne because June is Acne Awareness Month. Now, almost everybody will suffer from acne at one point in their life, whether it's very mild acne or very severe cystic and potentially scarring acne. It's estimated that 90% of men and 80% of women will at some point in their lifetime suffer from acne. We know that there's some genetic predisposition to acne. If your parents had it or your siblings had it, you're more likely to suffer from acne. And what we know is that it starts with inflammation in the skin, but we don't always know where that inflammation comes from. We have a range of how acne can present, however. On one end, we have very mild comedonal acne. Now, what that means in lay speak is that we have blackheads and whiteheads. A whitehead is a small pimple without a lot of inflammation, and you still have the skin covering up the opening of that pore. When it opens up, the oil is exposed to the air, it oxidizes and turns black, and that's what we call a blackhead. You can extract those, and it's a really satisfying procedure. You may have watched some on social media. Then we move into inflammatory acne, and this could be small red bumps and pus or very large red bumps with pus, and the more inflammation that you get, the more pain tends to be associated with the acne bumps. And then, of course, we have cystic acne. These are lesions that are very big and very deep in the skin, and they sometimes don't ever want to come up to the surface, and those are painful. Untreated, cystic acne can lead to permanent scarring. I joined TikTok back in 2019, and I quickly noticed that there's a lot of misinformation about skincare in general, and particularly around acne because it's such a common disease. We're all frustrated when we get a pimple, and that's why there's so many remedies that are touted as being the next best thing. All too often, however, I see these fads on social media that are more likely to cause harm than good. People trying to use baking soda, lemon, toothpaste, or a myriad of other at-home remedies to try to improve their acne. And as dermatologists, we don't recommend these, and I know that most of my friends who are skincare influencers don't recommend these either. The key to successful acne treatment is consistency with high-quality products. And then if you can't tackle your acne treatment with at-home products from good, reliable sources, then you need to see a board-certified dermatologist. I want to walk you through the typical consultation that I have with a patient when they come to see me for acne. Most of the time, the patient that I'm seeing is going to be a teenager, and what we want to know are a few things. One, when I see them on that day, is it a good day, is it a bad day, or is it a pretty typical day for their skin? Because I'd like to know how severe their acne gets. Oftentimes, things start to get a little better before you come to see the dermatologist. Maybe that's because you started using your creams a few days earlier, kind of like flossing the couple days before you go see the dentist. We also want to know if the lesions are painful and if they occur anywhere else other than the face. If you're getting acne on the chest, back, or shoulders, then the treatment needs to be adjusted to help tackle that kind of problem. When I do an assessment for the treatment of acne, it's important for me to understand the skin type that the patient has. If they tend to be dry and very sensitive, I have to be very careful about the medications that I prescribe because most prescription topical acne medications are very drying to the skin. I also need to know if they tend to be more oily because then I can be a little bit more aggressive and they're going to have more stubborn acne in some cases because of that excess oiliness. Sometimes we're going to prescribe oral medications as well, and we need to understand what the person's activity levels are. Do they spend a lot of time outside? Because sometimes the medicines that we use, whether they're topical or oral medications, may increase their sensitivity to the sun. So we have to be very careful about the way that we diagnose and then end up treating acne in the clinic. Many of the prescription medicines that we have available for use have over-the-counter counterparts that can be recommended as well. I frequently prescribe prescription-strength retinoid medications like tretinoin, but there's many retinols available over the counter. We often use chemical peels in my office to help gently exfoliate the skin and jumpstart somebody's acne treatment regimen. And there's many over-the-counter peeling solutions that are safe for at-home use when used under the right directions. It's important to understand your skin type as well, so that when you pick cleansers and moisturizers, you're picking things that will not over-dry your skin if you tend to be dry and more sensitive, or that will help to tackle some of that excess oil if you tend to have more oily skin. If you think your acne is severe enough that you need to see a dermatologist, I recommend searching for a board-certified dermatologist. That means they've gone to medical school and then completed a residency in dermatology, which is 3 years of focused training on the skin. They're going to be qualified to evaluate your skin and then to provide the right kind of prescription medications. However, not everybody needs to see a board-certified dermatologist, particularly if you have mild or mild to moderate acne. Oftentimes that can be successfully treated with great over-the-counter products. And if you don't know where to start, that's where there's so many resources available to you from other skin therapists or professional skin therapists. I've gained a ton of knowledge from collaborating with my colleagues who are skincare influencers or estheticians who have a great knowledge of over-the-counter products and of skin treatment to help exfoliate and gently improve the health of your skin. And through their work, I've seen amazing before and afters for acne treatment. The treatment of acne really can be a team effort, and I'm glad to be part of that team. The treatment of acne really can be a team effort, and I'm proud to be a part of that team. When somebody needs prescription therapy, I'm the person that they should come and see, but there's a lot of other great resources that I think you should check out, and I know that you'll be excited to hear from some of my colleagues here today. And with that, I want to hand it off to my Dermalogica skin therapist friends, and I know that you're going to love hearing what they have to say. Thank you so much for allowing me to be part of the In My Skin Real Conversations about Real Skin Dermatologica Summit, and I hope that you find the information here today very valuable.